Welcome to PCR London Valves 2024. I'm Chris Cook, and I'm delighted to be joined by Nicolo Piazza and Fabien Praz. Welcome to the studio, gentlemen.
Thank you.
Thank you.
So today we're going to be talking about some of the highlights, focusing on the tricuspid valve. So Fabien, perhaps coming to you first, has there been any research here that you think can inform our clinical practice?
Yes, so Chris, thank you very much for having us and asking this question. I think one of the new studies that just came out and was published in the New England Journal of Medicine is a TRISCEND-2 study. Obviously we have learned a lot about repairing the tricuspid valve with the trilaminate and the French studies, the TRI-FR study, and now we have a new study on replacement, which is kind of completing our view on the therapy of the tricuspid valve with a short follow-up, 1 year, but still a comparison, randomized comparison to medical treatment. And the main finding were actually quite similar to other studies showing that there is an improvement of quality of life that is, as we learn, dependent on our ability to reduce tricuspid regurgitation without significant difference at 1 year about hard endpoints, rehospitalization, and mortality. What we learn also from the study is that there is a price to pay to reduce TR with this valve in 98% of the patient, which is probably to have pacemaker. About 1/4 of the patient without pacemaker get a pacemaker after the procedure. And there were also some bleeding complications that were much lower compared to the TRISCEND-1 study. So in the TRISCEND-1 study, 1/4 of the patient had bleeding complication during 1 year, and it was only 10%. So we are learning and we are improving our outcomes.
I think that's right. The evidence lets us continue to learn and develop. Thank you. Now, of course, there's many innovations within the tricuspid space, new technologies, new imaging techniques. Are there any highlights from the program around innovation that's caught your eye?
Yeah, well, if we, Chris, concentrate on the procedure itself, it's not really an innovation, but I think it's an innovation technique, so to speak. Now there's the introduction of ICE. And so there was a recorded live case that demonstrated how and when to use ICE during a tricuspid TEER procedure. And so we're starting to realize that in many cases, ICE can be very useful to grasp the leaflets and confirm leaflet grasping and get better long-term results. The problem is that we need the education on how to use the ICE during our procedures. And so there was some nice demonstrations on the recorded live on how to do that with a clip in place.
And that's London Valves. It's about education, isn't it? Okay, gentlemen, we're nearly at the end. What are the challenges that still lie ahead in the field of tricuspid intervention?
So, obviously, I think we still need to have some improvement in terms of design of the valve and maybe the edge-to-edge as well. There is a lot to learn and to do in terms of improvement of this catheter. And I would say, one of the challenges is to have the best catheter, the best device that is able safely to treat most of the patient. And that's still something we need to figure out, but a lot of innovative, this field is moving so fast and a lot of innovative solutions will come in the future.
Yeah, I think patient selection is also very difficult currently in the sense of who are the patients who are going to get the best results and get the best clinical benefit from these procedures. At the moment, we're seeing a lot of patients getting quality of life improvements, but the big question remains, is there a mortality benefit? Who are those patients, perhaps, that might get a mortality benefit? Are we treating them too early, too late in the disease process? I think we're still very early on with patient selection.
Fantastic, gentlemen. Well, thank you for sharing your insights and, in fact, your highlights, focusing in on the tricuspid valve.